It looked like a horn that was sticking out of my head.
Ever since the natural gas industry moved into Jeannie Moten's neighborhood 5 years ago, she says she and her family have been sick.
Oh, we were so sick we couldn't move. We had it was like the flu times 10.
Explosive diarrhea, throwing up, everything hurt. This is the well that provides water to my mom's house and to my house up here.
Just up the hill from this well, in this tiny town of Ray in Washington County, Pennsylvania, there are at least 10 natural gas wells. Nearby are ponds like this one, full of wastewater from the hydraulic fracturing process, which injects sand, water, and chemicals into the ground to release underground deposits of natural gas. Knowing this, the Moten sisters convinced the state to test their water.
Barium is 0.0756. Reporting limit is 0.0100.
Metals like barium, strontium, and manganese all measured higher levels than normal in their water. Urine tests showed elevated levels of hypuric acid, a toxic substance that can cause asthma-like breathing problems.
We call it a frack shower. Rarely I do that, or else I just wash up.
What is a frack shower?
Use your water. You're as quick as you can and get out of there.
Are you buying water for cooking and for drinking?
Have a drink of water. Yes.
Okay.
Yeah, we don't cook or drink it, no.
Even now, both women say they suffer from lesions on their skin, of headaches and hair loss. Do you think that your symptoms are connected to the water or to the air?
Both.
What makes you think that, Debbie?
Well, now that I completely stopped using the water, there are still symptoms.
The Moten sisters are not alone. The Southwest Pennsylvania Environmental Health Project reports 27 cases in this county with similar symptoms, including breathing problems, nausea, vomiting, and even skin irritations, all of them linked to natural gas development. But Steve Ford, a spokesperson for the oil and gas industry in Pennsylvania, insists that there's never been a proven connection between hydraulic fracturing and the contamination of anyone's drinking water.
I'm not aware of any example of hydraulic fracturing anywhere in the country that has been connected to groundwater contamination, the practice itself.
Meaning that there are other causes, but it's not the practice of fracturing.
When water comes back up to the surface after hydraulic fracturing takes place, there could be mismanagement of fluid at the surface.
Nonetheless, medical professionals in Washington County, Pennsylvania heard so many health complaints that they launched a project to monitor the health of people living near the wellheads.
Those people who are living near these sites have to protect themselves. And we have to tell them what to do to protect themselves.
David Brown is the toxicologist working on the project. He says in areas where there's natural gas development, the team has found more health problems connected with air rather than water.
The cases that we reported in Washington were all near sites of some sort. They were usually within half a mile or so.
Brown says some of the chemicals the team has discovered in testing are so rare, scientists have no information on what impact they could have on the human body.
We know there's radioactivity in the material. We know people are drinking water and breathing air that contains it. And we know that radioactivity causes cancer long term.
We asked the acting director of the Pennsylvania Department of Environmental Protection if he was aware of the symptoms under study. What do these homeowners who have health effects, some of them talk to me about lesions, growths on their head, hair loss, what did they have to show the state to become part of a study or to contribute their information to this so that they can be heard?
What do they have to show the state? I haven't seen, I have to be honest with you, I've not seen these medical reports citing to these kinds of issues. We know that we need to do air quality studies because we need more information about what what the impacts are.
Pennsylvania's Department of Environmental Protection is conducting its own air study in the county where the Motens live. Meantime, Brown and his team are sharing their data with global researchers in the hopes of getting the U.S. government's attention to order a national public health study.
But until the government moves, somebody has to protect the public health.
And I know for a fact that it's gotten worse.
Still, Brown says many of the patients in the study are giving up hope.
My problem is that they have turned us into society's junk, society's rubbish, and left us with no explanation and no help
The gas developers say they're extracting the shale gas safely. The Motons say the extraction has left their lives as fractured as the ground beneath them.